successful strategies. As we begin, I would like to recognize that we are all living, working, playing, and learning on the lands of Indigenous peoples. Our research center is on the land that's now called Hamilton, Ontario, and it's the land of the Mississaugas and the Haudenosaunee. And we recognize that the work that we're presenting today is coming from within a colonial and Western medicine framework, and that's really the grounding of where we have come from. But where we are really working toward is a new understanding, working with Indigenous peoples across the country and starting to learn how Indigenous ways of knowing and doing can really make a difference to the work that we have already started and where we want to go. So as I said, we'll be highlighting some of the findings from our implementation work and studies, reflecting on these important strategies that we have found to be effective in implementing the F words, and then talking about some of our future directions. Where are we looking to go with the F words implementation, and both from a research and science perspective, but also from an implementation practice perspective. So for those of you who may not have heard of the F words, we will give a very brief introduction, and if you were here this morning, you heard Peter's reflection on how this piece of work has really made a difference in our field and how it's making a difference for children and families in the ways that we're providing services, the ways that we're thinking about services, and the ways that we're thinking overall about health and well-being. This is an image of our F words research and knowledge translation program. And it's not new for anybody who is in this room. There's been many reflections on implementation and knowledge translation over the course of this conference already. We started with diffusion, publishing a journal article, moving toward looking at dissemination. How are we sharing these messages? And now really working at the level of implementation, making these ideas work, making them practical for providers, for families, and for services and policymakers overall. This is the vision, the poster of the F words as integrated with the ICF framework. This, as Peter shared earlier, has had an impressive impact on our field, being downloaded over 62,000 times. And we have to update this slide every time we present because these download numbers just have been increasing astronomically. And within our field, we know this is a very, very big impact. We presented over 200 times internationally and are really excited about the language translations. And as Peter mentioned earlier today, some of the really impactful work is coming around the cultural adaptation. So not only what do these words mean, not only thinking about them as F words, but thinking of them as my favorite words, thinking about the definitions of these terms, family, fun, friends, functioning, fitness, and future, and what do these really mean for people in different contexts? And then those images, how can we make these images more culturally relevant so that the ideas apply visually to people as well as conceptually? I'm going to pass along to Vanessa to share some information from our implementation studies.
Thank you, Racheal. All right, so like Racheal said, my name is Vanessa, and I am a postdoctoral fellow at McMaster University working with CanChild as well as the University of Manitoba. And I'm very honored to be able to share a lot of the implementation work on behalf of our team. There's so many in the room right now, and so many people, researchers, providers, families, knowledge keepers that we've been working with over the past few years to really better understand, unpack, and pursue this work together. Guess I don't have to point it right at it. All right, so we have two current implementation-focused studies or initiatives that we've been doing at CanChild related to the F words. So first is our organizational implementation study. So really, what does F words implementation look like at an organizational level? And then the second one is the development, implementation, and evaluation of our new F-Words online training program, or the F-Words Foundations course. So we'll talk a little bit about both of these studies, very, very high level, alongside some preliminary findings. All right, so our organizational implementation study. So back in 2020, we received a CIHR planning grant to bring together some key people to really explore, in particular, the focus and interest was around impact of the F-Words. So anecdotally, we knew these ideas were making a difference. We knew they were helping services for families, providers, but we didn't have or formally study this. And so that's what we wanted to do. But when bringing together these different people, including organizational leaders, service providers, families, they also brought up the point, we actually don't know what this means in terms of implementation. So what does F-Words implementation actually look like, right? So the F-Words are a framework, they're a philosophy, a way of approaching and looking at services differently. So what does that look like in practice, right? It's not as clear-cut as a guideline or a program that you're kind of rolling out or implementing. So this actually then ended up becoming our primary goal, and which we'll be focusing on for this presentation. But I want to acknowledge that we have had incredible contributors, partners on this project. So we have 4 organizations in Canada, 3 in Ontario, 1 Manitoba, and then 1 in New Zealand. And this was supposed to be a pilot study, which then turned into not a pilot study, and completely unfunded, all in kind from these organizations, which really just shows the passion and commitment to F-Words implementation and the belief that these ideas can make a difference for families. And so really, we formally rolled this out starting in 2021, and we have just finished data collection. So like I said, we're going to focus on research objective 1 because that's really around the implementation piece. So what we really wanted to look at was contextual factors. So what organizational factors, barriers, facilitators are influencing implementation of the F-Words? We also wanted to track these strategies. So like I said, a lot of us were kind of like, we know people are using the F-Words, but we don't really know what this looks like or what this means. So let's start tracking this and better understanding, the most useful ways to do this so others can learn as well, and we can learn together. And then also looking at the acceptability, feasibility, appropriateness, and capacity for sustainability, right? It's one thing to, roll out these initiatives, but is this something that's going to be sustained in the long term to have that meaningful impact? So what did we do? For implementation, each organizational site had implementation teams. So these were the key people who were really leading and rolling out that implementation. And we also had each organization select some key programs that they wanted to start with in terms of F-Words implementation, although a lot of these organizations like Children's Treatment Network had been doing this for years and years prior. So also to kind of study what they did before. We also provided and developed implementation tools and supports. So we created a blueprint so people could identify their goals, what are some speculated barriers, a tracking sheet for them to track these strategies, and also to look at how they've evolved over the span of the 2 years, right? And how that's changed, right? We know implementation is not linear. It's quite complex, and kind of going back and reflecting on those learnings. We created a toolkit to help with some of those implementation science concepts as we were rolling this out. And then we also had guiding questions for the team, so just some examples to help with monitoring. One of the coolest parts of this, and what we're continuing beyond this study too, is this community of practice that we created. So we met monthly to talk about the study, but what we really found and what we've heard from organizations was the opportunity to learn from each other, to share resources, not reinvent the wheel, right? If someone had incorporated the F-Words into a form or a report, another organization was thinking of doing that, and so we could learn from each other. And so that was really, really valuable, and we stored all the resources on a platform called Basecamp to help with tracking, but also the other organizations could kind of go look, get inspiration from different organizational examples. And in terms of the evaluation for implementation, specifically for research objective 1, we looked at administrators. So by that I mean, program managers, organizational directors, CEO. We had a CEO as well participate, and the different implementation teams. So we did pre-post surveys, as well as interviews for administrators and focus groups for implementation teams. And in between this is really where they rolled out that implementation and began tracking it and reflecting. And to analyze the data, the classic means, frequencies, some of those things. We did a directed content analysis. Basically, this means that we had a framework, which was the consolidated framework for implementation research, to guide how we approached that qualitative analysis, right? So we could identify some of the factors and barriers and facilitators. And then all the strategies that we're tracking, we mapped these to the expert recommendations for implementing change. So basically these evidence-based strategies that have been consolidated by researchers and organizations, so that we could understand what these mean in the context of the implementation science literature. So very high level, what we've found so far. So some barriers and facilitators to F-Words implementation. I'm not going to go into all of them, and for context, the terms on the slides are from the Consolidated Framework for Implementation Research, which is an organizational level framework for understanding barriers and facilitators. So for example, we heard staff and family capabilities and opportunities. So knowledge, skills around F-Words implementation, the time required, and some of that understanding. Critical incidents. When we did this, it was peak COVID, and so that was something that came up a lot, is that staff time was being pulled to other things, their priorities were shifting. However, F-Words implementation did remain intact, and again, just speaking to that passion and commitment. The design, so Racheal spoke a little bit about the cultural relevance and appropriateness, and something that we're exploring, and that came across in terms of some of the feedback, is the connotation of F-Words. Not everyone likes that, right? And to be respectful of that and understand that. And so looking at that as well. Some facilitators, so the biggest one across all the organizations was really that leadership buy-in, that commitment from the organization, so those high-level leaders. Relative advantage, right? That the F-Words go against the traditional, typical Western, deficit-based, fixing approach to child health and developmental services. Compatibility, so that it fit with organization values and norms, and a lot of these organizations really commit to family-centered service, right? So there's that natural connection. So I won't go into all of them. One final one I'll highlight is the partnerships and connections. So they spoke to the connection to CanChild, to that research. Having that backing was really valuable as they approached implementation, as well as the connection to the other organizations so they could learn from each other. Some of the implementation strategies, and again, just a couple examples, and I'll just highlight what these looked like in the local context so you can see the expert recommendations for implementing change, or ERIC category, and what this looked like in the context. So for example, at Sky Center in Manitoba, or Specialized Services for Children and Youth, they put the F-Words on, or they're calling it Our Favorite Words, on screens and clinics in the rooms so that people would ask questions, become aware of it. Children's Treatment Network has it embedded in their shared record system, embedding it into forms, so the visit summary at Halton Children's Developmental Services. And this is just a small example of all the incredible things the organizations have done over these past few years. And so again, you can see on the slide the different ways, adapting the F-Words, so Our Favorite Words, changing some of the pictures to make it more appropriate for the context, our community of practice, etc. And then we also found that, and unsurprisingly, the F-Words were deemed appropriate, feasible, and show potential for sustainability across the 5 organizations. And just to highlight, we are taking a case series approach to this evaluation, so you can see the numbers are a little small, or the participant sample size, but we're looking really at each organization because we recognize that the context really influences implementation, and so we wanted to explore that within each organization. And so you can see that example on the slide there around acceptability, appropriateness, feasibility, and potential for sustainability. And so I'm going to pass it to Kim now or after this slide, where we led into, so one of the findings that actually came up early on in this study was the need for more training for families, for providers. So typically our training was more geared towards service providers, although we really encouraged and often involved families. But there needed to be more accessible, readily available training on the F words for providers and specifically families. So this led to collaboration with the Ontario Ministry of Children, Community and Social Services to propose, and then they funded the development of an F-Words online training program, or our F-Words Online Foundations course, and then the Kids Brain Health Network funded evaluation of this. And so there's just some quotes on the slide there that you can see that came from participants in that pre-study to highlight the need for this training, and then that kind of led into our next initiative, in which Kim will describe.
Shorter. So this is a URL to that provincial module that it's now up and available for free on the CanChild site. My name is Kim Hesketh. I'm not a researcher. I don't work for CanChild. But I work for the Children's Treatment Network as have the opportunity to have a unique role where they call an implementation lead or an implementation specialist. So really I just work with a variety of people to implement new programs and new kind of services. So this was one of our biggest one of my first ones, and by far one of the ones I'm most proud of. So I joined way back at the beginning, but was part of this online training module development, but I'm actually just gonna, she invited me up to talk, and then I have to let somebody else talk. So we're gonna hear Danijela actually speak about the program. No, we're not.
Hello everyone, I'm sorry that I cannot be with you there in person. My name is Danijela Gravhovac, and I'm here, well, I have two roles here. I'm a parent. I have a son with cerebral palsy, and he is 20 years old. And as a parent, I was involved from the beginning in Efforts project, so it's been a decade now. And also I am working at the CanChild as an IT person, and with my team, we developed the online training program, Efforts training program, that I will tell you a little bit more. It's free online self-paced course at the moment, and it has 5 modules, as you can see, and you can access it by scanning the QR code provided or type in the URL. I will quickly show you how it looks like. So when you scan the code or enter the URL, you will get to the home page of the course, where you can read a little bit about that or watch the intro video. But to access the code, to access the course, you need to log in, actually sign up. There is a French version as well for those who wants to learn it in French. So I already did log in. So when you click here, you will get into the course homepage of the course. You can access in a different ways, which is these links here, or you can go like this and start your module 1 by clicking on the first link. It will the site will follow your progress and give you a percentage how much you finished, and basically these are like very short pages. We try to make it as clean and as easy as possible. You can go in and see all these videos. Click by next or use these links here. You can see how it will show you where you are. There is a Peter introducing what you're going to see. Then, you will have a reflection where you can think about it. Then you can see me and my son Vasilia, and hear our story. It's a little bit long, but I believe it's really fun to listen. Then again, Peter for this one. Then we have some fun activities like crossword puzzle to do, summary. For each module, we have a summary, and then we have our resources that you can read and learn more. At the end of the course, you will get a certificate, and what you need to do. Your progress needs to be 100%. Now I will get back to my slides and tell you a little bit more about feedback. So from May 2022 till October 2023, 1,335 participants completed the course and provided feedback through 3 embedded questions. I can tell you a little bit more about how many people we actually have, because this is not all people that did a survey. So at the moment, there is about 2,500 participants, and we have about 1,500 people who are certified already. So yeah, a lot of people already learn about efforts. So most of the participants and learners have been healthcare providers. We are looking for more participation with and the feedback from families and people with lived experiences. Feedback from these 3 questions centered on what participants liked about the course and areas for improvement. For example, participants like hearing from families and providers. They like tools and videos and embedded resources, that the course is self-paced, and the efforts concept themselves, really seeing the benefit of the ideas and its focus on strengths and abilities. Some of the areas for improvement or more constructive feedback focus on considering the connotation of efforts and how this might not be appropriate for some families or cultures. That the course itself is too long, the need for more interactive elements like discussion, opportunities with other learners doing the course, and so on. One of the things that we are suggesting is that you do 1 module per week, and let it sink in. So you can see here examples of some of this feedback through the quotes here, and I will just read you one of these. The information is clear and easy to understand. Parents, people, and professional stories and sharing, very informative and useful. Okay, so about implementation. Well, in January 2022, we received funding from Kids Brain Health Network to pursue a more formal evaluation of our Online Efforts Foundation course and training program. Research objective 1 was to access the usability, acceptability, and feasibility of the online course. Research objective 2 was to evaluate 2 versions of the course, the original self-paced version and 5-week online facilitated version. Our team developed guides and resources for facilitated efforts sessions to complement the online self-paced course. We are now calling these facilitated sessions efforts conversations. The efforts conversation involve participants completing the self-paced course and participating in 5 one-hour weekly synchronous group-based sessions led by our team-trained facilitators. These sessions will be interactive and involve group-based discussion and activities. We are comparing these two versions of the course to explore accessibility, feasibility, and how appropriate it is, impact on family empowerment and family-centered service, and overall experience with the course. We have finished Objective 1 and are now starting recruitment for Objective 2, and my colleague will share some findings and opportunities to participate. Thank you.
Sorry, we're just sitting up here laughing because everything she just said is what they told me I should talk about. So we're gonna move along. So the development of that course was actually a pretty cool process to go through. These guys included families and providers from all over the world. So when we were having our meetings, it was like Brazil and New Zealand, and the videos that were sent in and the examples were pretty inspiring. So unfortunately, you see my little headshot there, but really we just introduced the cool people who told us actual stories. So it's quite emotional, especially watching Module 2 if you want some tear moments. So yeah, we'll go through this fairly quickly now, but we did do the formal part of the evaluation, so that 1,300, whatever, that was a lot of just built-in quality improvement when we initially built it, and then we did more of the formal evaluation where we did an online survey and some Zoom interviews. And we had about 61 people do the survey and 7 interviews. And the feedback we got was very much in line with the things we heard from that online feedback things. These were kind of the themes, but pretty much people said this is nice, it's accessible, it's online. It was very positive feedback, which, you know, after being on the recording studio for so many days, was nice to hear that we weren't going to have to go back and do that again. But there was also comments in there about the usability of it and the practicality of it, and that it's real life stories and wasn't, you know, something that was being preached at, but it was that an actual ground level kind of usable format and the tools that we presented with it. But of course, there's always suggestions. No one gets 5 stars without areas for suggestion. And one of the biggest ones, as Danijela had mentioned on there, was the fact that although some people really do well with the self-paced online learning environment, some people really do need or can benefit from that facilitated discussion. You know, it's one thing when we're in a room at a CTC or something like that, and we have all our colleagues to banter with and talk ideas through, but sometimes families or providers who don't have that opportunity really thought it would benefit to do it with other people. And so stage 2, where we're recruiting now, and by we I mean them, really, and we're looking for both providers and families who haven't taken the course yet to either sign up, and you can choose to do it self-paced or in the facilitated version that I think starts in a couple weeks. So if anyone is interested, there's the email, or just find Racheal and Vanessa. If you find me, I will point you to them. So may as well just go straight to the source. And I think, yeah, that's it. Where are you?
All right, thanks, Kim. Okay, so some of the findings, so again, one of the key pieces that came out from our implementation study was around the need for training, and then that led to the development of this online training program and platform. Another thing that has really come across strongly is the need to kind of take a step back and understand what these F words, concepts, and ideas mean from different worldviews and perspectives, and really exploring the cultural relevance and safety. And so our team over the past year has been starting to do this, or year and a half, 2 years now probably, starting to do this and really deconstruct these ideas and working in partnership and building relationships, specifically with First Nations communities in Ontario and Manitoba, and really in the early stages of that. But on the slide here, you can see just some examples of what came across from the study. And there's one quote here that, oh my goodness, my eyes, I can barely read it, but I will do my best. So fun doesn't mean the same Western fun from people that come from an Indigenous or different cultural background. You have to be descriptive with it. It's like fun. What does that mean? What is fun? Is it that they have played all day long out in the sun or in the snow, or is it the creation of food? What does family look like? And these concepts mean different things to different people from different cultures. And so really starting to explore that. And also, maybe this isn't something that's even meaningful or helpful, and that's okay too. And just so really, really starting to explore this together in partnership. And so we're really, really privileged to be able to be doing this work and pursuing this work. And so we wanted to highlight a video from two of our friends and colleagues who are in New Zealand, who have really done a beautiful job starting this work, working with some of their Maori families, and I will let you hear from them.
Here we go. Kia ora tātou, ko Charles toko whānau, ko Lucy toko ingoa.
Kia ora tātou, ko Hemel toko whānau, ko Arul toko ingoa, and I'm Arul Hemel.
So thank you for this opportunity to share the work that we've been doing in Aotearoa, New Zealand, alongside CanChild in Canada. And it's enabled us to hear the voice of children and families, whānau and tamariki. The F words have really helped us to shift to a much more strength-based approach and a much more strength-based conversations with families. And we've had some beautiful Māori families and Kamatua elders who've shared some concepts that really have resonated with us when we're thinking about how we connect in a way that's culturally responsive with whānau, family, tamariki children and rangatahi youth, being able to be reflective and not reflexive. So we're thinking about whakawhānaungatanga, that connection on a deeper level that truly values the whānau and tamariki, and thinking about ako, the concept of providing space, listening first in a non-hierarchical way, and rangatira, that self-determination that gives whānau and tamariki that autonomy and choice, giving them back some control so that they lead the conversation, and thinking about asking things like what would have the biggest impact on you and your family, and again thinking about manaakitanga, and how we do this in a respectful way with generosity, araha and compassion, and how we interact in non-judgmental ways, making strength-based assumptions. So as we were embedding the F words, we've been also thinking about coaching frameworks and how these can enhance those conversations with families around thinking about what they'd like more of in their life. And we put together those concepts into a framework which we call the F words life wheel. And it uses a simple rating scale to measure satisfaction, but it's the coaching conversation that really enables us to envisage and visualize what families would like more of in the future, enabling them to dream of possibilities. And again, giving back that voice to the family and the child when we're thinking in terms of goal setting or thinking about next steps. And we often talk about the hub of the wheel, really capturing those core beliefs and values that underpin coaching, but also thinking about Māori health models such as Te Whare Tope Whā, which is a model developed by Mason Jury that really highlights the importance of concepts that include spirituality and connection to whanua and rua, and the importance of stories and families being able to share their stories, and children using pictures or huruhuru as a way to communicate and share what's important to them. And we've been working with some wonderful kamatu about the ways that the F words could be communicated or represented differently in New Zealand. So not just translating them into the different language, but thinking about what the words hold in terms of meaning, and enabling Maori to voice how they would like to have this represented visually for their families and their children. And this is a little example of a little 6-year-old girl who's been able to use the F words and some pictures to really communicate what was important to her. And so it's just been a wonderful way for us to be able to capture her voice as well. So we just want to thank CanChild for the wonderful work they do, and we'd just like to hand back to Vanessa now. Thank you.
Thank you.
Wonderful. All right. So I think I'm passing. Do you want me to just keep? Okay, sure. All right. Okay, so yes, you saw that beautiful example and some of the work that they've been doing over these past few years. Our friends Lucy and Arul, don't think I said their name at the beginning there. So just to acknowledge again, like so much of this work, it would not be possible without, the partners and organizations and individuals like them and Kim and so many others in the room today. So one of the things that kind of came out again from this implementation study was the need not only for F-words training, but support around implementation, and not just, rolling out implementation, but understanding why we're doing what we're doing, right? So that implementation science piece. And so we really wanted to start, and it's very much in its infancy, and we're still developing this, but creating some sort of implementation support program. And we've had the opportunity to do this with an organization in BC, in Ontario, and we're starting to do this further in BC in November. But really creating something that includes, that F-words core foundations training, but also an implementation science 101 training that is specific to F-words implementation. We have learned so much over these past few years, and building that into this program to understand, what strategies are other organizations finding useful versus reinventing the wheel? What are some common barriers and facilitators? And really building this into the program. We offer coaching and consultations through this, again, super, super new, and Kim and I did this, I think it was a year ago, 2 years ago, time is, where we provided the support for an organization in BC, to really work with them to have that output of creating a work plan, as well as a sheet where they can track and identify their implementation strategies. And with virtual, we did this over Miro, so you can see one of the screenshots on the slide. It's not there anymore. There you go. One of the screenshots there. So we were able to do this very collaboratively and hands-on versus if it was in person. And then we also shared the toolkit, which we adapted and enhanced a little bit from our learnings through the implementation study for this program. And so we've created very much F-word specific implementation tools and resources to support organizations with F-words implementation. So if you're interested in this, please feel free to chat with us if you want to learn more. Any ideas as well? We're like I said, this is very new and we're still developing this. And then our email is also on the slide there. Okay, so just to wrap it up, so some implementation learnings, tips, and strategies that have come from our team, the organizations we've worked with. So really, again, the importance of establishing implementation teams, having that dedicated group of people at each organization or at each site dedicated and committed to this work. And also from the management perspective as well, right? Allowing these individuals that time to do that versus it being at the side of their desk. The importance of a community of practice, that is something we're hoping to establish and start more formally in 2024 for different organizations interested in or already implementing the F-words. So if you're interested in joining that, come chat with us. The importance of tracking and monitoring implementation progress and strategies. So this has been so neat to see how this has progressed over the past few years and how the strategies have changed, how they're revisiting them, how they're enhancing them, and also recognizing maybe we took on too much and this isn't feasible right now, and that's okay, and kind of prioritizing. I said this already, that leadership buy-in and having those champions really key to drive this initiative. I've said this so many times, we wouldn't be able to do this work without our organizational partners, family partners. That knowledge user engagement is so critical. It's essential to do this work right and to do this work meaningfully so that initiatives, any implementation initiative is sustained. And then as well, understanding and assessing context. So like I said, we're looking at each organization separate. And even, for example, the political context, right? In Ontario, the F words are part of, that mandate for the MCCSS. And in Manitoba, that's not the case. And what are some of these tensions? What does that look like? And what does that mean from an implementation perspective? Looking at organizational readiness, all those different things. So we've learned a lot about this throughout the past few years. And very grateful for our organizational partners to have pursued this work with us, and really just starting and learning together. And we're excited to see what happens next and where we go from here. Thank you.